Nearly 2 weeks after that deadly school shooting in Nashville, Tennessee, doctors tonight are sounding the alarm over deadly gun violence impacting kids and teens.
Well, tonight, data from the CDC shows guns are the leading cause of death for young Americans. And it's a trend that has only climbed higher in recent years.
So tonight, our Rachel Krause talked with an Indianapolis doctor who told her those numbers are heartbreaking, but not really surprising.
It is a sad thing because many of these are potentially preventable.
Dr. Brett Engbrecht, medical director for pediatric trauma with Ascension St. Vincent, says their team is ready around the clock to help kids, regardless of their injuries. But cases where kids come in with gunshot wounds are especially tough.
There's somebody who has value, and it is sad, if we could prevent some of them. And it's not just those that die, but those who are injured and survive still have consequences from that and long-term impacts. So it is a sad thing.
Data from the CDC shows guns are now the leading cause of death in children and adolescents. In 2020 and 2021, guns killed more people ages 0 to 19 than car crashes, drug overdoses, or cancer.
It is shocking. At the same time, those two lines of motor vehicle collisions and deaths and firearm deaths have been closing in on each other.
But while improved safety with car seats and seatbelts has reduced car-related deaths, the number of deadly shootings has only climbed higher in recent years. And Dr. Engbrecht says when children are shot, those injuries can be more severe than for an adult.
When a bullet hits somebody, it's not just the actual bullet that causes injury, but the energy that bullet creates can destroy tissue around it, especially like the high velocity bullets. Those cause more extensive damage surrounding the area the bullet was. So in a small child, that injury pattern may hit many more organs.
He says many of those deaths have the ability to be prevented. And while the debate over how to do that is controversial, he says it's something that needs to happen to turn this deadly trend around.
We don't want kids to get hurt if we can prevent it. And for those who do get injured, we want to take the best care of them we can.
So, Rachel, what can be done to help keep these kids safe?
Well, they say education about the severity of the issue is key, and they're encouraging adults to talk to their kids about gun safety. And if you keep firearms in the house, make sure that they're locked up and secured away so your child can't access it. And if the worst should happen, make sure that you take your child to a trauma center where experts are ready and trained to handle these kinds of injuries.
Yeah, that's good advice. Rachel Krause tonight, thanks.